GLP-1 drugs like Ozempic are taken by tens of millions of people. But in 2023, regulators opened investigations because the databases of adverse events were filling up, of reports of suicidal and self-harm. We then wanted to explore this paradox. Randomized trials were showing not such risk, but these spontaneous reports was showing them. So we built a system on this Claude Life Sciences Hackaton to explore that, and the answers are actually more interesting than just safe or dangerous. First of all, we refuse to pull everything together. We design studies, we design a meta-analysis tool that will analyze bias in studies, grade them, pull information together, and check and scale to the human when necessary. Second, we design a different skill as well for extracting information from the openFDA database. We explore the plausibility mechanism, and last but not least, also using this database, we explore the potential addiction benefit of these drugs. So here is the picture. Depending on what is the comparator or what is the source, we see very different odds ratio for harm. This spike is actually interesting because it doesn't stay in time, it doesn't maintain. It peaks just at the moment that we were having this news all over the media. And then it just fades out. And interestingly, it only happens for semaglutide and not for other drugs in the family. So there is a very clear temporal spike that can confound these adverse reports. We also tested thoroughly these tools, both the risk of bias tools or the one that I'm showing here, which is able to recover adverse events drug pairs from the openFDA database with quite some good accuracy. Interestingly, when we apply the same methods for the potential addiction benefits, the signal holds and it holds over time. And what we see here is it's an actual decrease of this addiction outcomes in people that are in this drug compared with general people in the openFDA database. So very interesting way and very new application that we can use for any new drug or any development. So the alarm didn't hold up, but the actual upside of these drugs for addiction might. So I think it's an interesting finding, something that I built in just a few days in this hackathon. Everything is available on the Apache and the GitHub on the Apache licenses, and thanks for everything.